outcomes. We're going to identify effective techniques in developing abstracts for submission for AANA meetings. We're going to help you understand the submission and evaluation process for abstract submissions. So this is what it looks like when it comes up on the AANA website. Call for abstracts. That means I want to speak. Okay, that's really what it is. So it doesn't say, hey, if you want to speak at the next meeting or whatever, it's a call for abstracts. And the call for abstracts is, I want to be a speaker. So this is what you're looking for on the website. This is the actual way that it's going to look on the website come September 1 when it actually opens. It gives us our deadline. Thank you for your interest in submitting an abstract for consideration for the 2023 annual Congress that's going to be in Seattle, and it gives you the dates for that next year. This is literally, that's what it looks like on the website. It's pretty easy. Here's our deadlines. The submission deadline this year is October 3rd.
And opens September 1st.
Opens September 1st. After that deadline, it's again hard stop. And it's 11:59 Central Time.
Yeah.
So for those that are in Pacific Time or Mountain Time, if you're like me, you have to go back. And we do get them right up to the end, and we've had some that missed the deadline because they were in their time zone at 11:59 submitting it, and so that.
And there is nothing we can do at that point. We
Yeah.
cannot accept them. So
Yeah. So we accept, as a presenter, you can submit up to 3 abstracts. So if you have 3 different topics that you want to, you're able to do all 3, and they're blindly graded by the committees that do that, which George and I are on. The Professional Development Committee, depending on the topic that you choose, if you're doing a wellness topic, then a wellness committee, they will be reviewing that abstract. So you can submit that and know that it's blinded. No one knows your name or anything about it. They're simply grading the abstract based on the quality of what you put in there to be what you're talking about, okay? The sessions, you can determine how long you want the sessions to be, anywhere from 15 minutes to an hour. Sometimes people have a quick little research topic, and we do choose 15-minute sessions.
yeah.
They're great as little fillers along the way. Students do a lot of something. Let's say that they did a project in school and they just want to do a quick little, then we accept a lot of those. A lot of them are student presentations that are 15 minutes, but not just student presentations. If you want to do a 15-minute presentation, pop it in there.
And sometimes someone will put 15 minutes and we find that it's so interesting and we're thinking, no, we need more of this. And so then we'll go back to you and say, okay, we accepted it, but we would really want you to consider doing it for 30 minutes. And the opposite is sometimes true too. Somebody will say for 60 minutes and we'll say, well, really, you may only have 30 minutes. And so sometimes we kind of work with that. It's not the usual, but it has happened.
Yes, that's correct. I told you about it being blinded.
Yeah.
Probably the biggest thing that will hinder the grading for someone that presents their abstract to us is that the references are not current. So we're going to talk about that a little bit more in detail, but to keep that in your mind, the references need to be within the last 5 years, and some topics are not going to have references that are within 5 years, depending on the topic, and we understand that as well. But you try to keep them within that time frame. If you don't, you get marked so far down on the scoring, because we need the evidence to be current. That's what we're here for. We want the latest research, because that's what we're presenting to each other, to learn from each other.
And we'll give you examples of how we scored in just a second.
Totally. Nonprofit organization. So as a speaker, you don't get paid. There is a small honorarium, which is a little incentive, but there's not a designated You're going to have your room paid for, you're going to have your travel paid for. Those things don't exist because we are a nonprofit organization. We do this because we are giving back to each other. We're helping each other with our education, and so just know that ahead of time. There is a tiny incentive, but we don't mention it a whole lot. There is, but you will be responsible for your own travel and your own room and board. You'll have to register yourself for the conference and things like that.
The biggest incentive is bragging rights, guys. That's really the biggest incentive. I'm presenting at the AANA. That's bragging rights right there. So that's the incentive that you should have in your mind of why you're coming to speak. So
Yeah. So the submission content outline, it's not the submission page. It will give you an idea of the things that you're going to have to prepare in order to do the submission. When you get ready to do the submission and you go in and you actually are filling out the fields, this is so that you can look at it ahead of time so that you know what to prepare before you get there. Does that make sense? So you're not preparing a whole lot of things that you don't need. That's available, that's on there. This is I'm going to go down through these kind of one by one. The information that's going to be asked within the submission site, here's what you need: a title. We'll talk about that a little bit more in depth on a couple of slides later. 150 characters max. You have an identified gap that's going to be required. You're going to need a description of the current state, meaning how it is that we practice, or whatever it is that your topic is, that we aren't using ketamine and we need to use ketamine, or we aren't using Sugamidex and we need to use Sugamidex. You're going to put that current state that's in there. The description of the desired state. What is it that you want to achieve by your talk to us? You want us to use Sugamidex. You want us to use ketamine because we're not. That type of thing. The gap that's going to be addressed, is it a knowledge gap? Is it a skills gap? Or is it something directly in our practice? And then there's an other blank where you can talk about something else if it doesn't relate to those. Learner outcomes. The AANA and the ANCC that credential us for our CEs require one learner outcome for 30 minutes of lecture. There are resources within the submission process that our Brett Morgan, who submits for all of our CE for us, he has made that in there for you. You can click on it and open it, and it gives you examples of how to write a learner outcome, and we'll help you with it. If the learner outcome, when you submit it, is a little off, we note that as a committee, and we'll just put a comment about it, and it might even get rewritten.
and we'll show you where to find that in just a second now too.
Okay, let's go to the next little thing. Content outline. This is where you're going to put the body of what it is that you're talking about. You do not have to write a big research project. That's not what we're looking for. This is not a place where you put a gigantic research project like it was when you were a student and you were doing your doctoral project. You can literally just put the outline, a complete outline of, this is what I'm going to talk about. I'm going to talk about why we don't use ketamine. I'm going to talk about,
Gases in the OR and how they affect the ozone layer. I mean, we had one like that, and that was a very interesting topic.
And then you give the outline of the things that you'll be describing in that. You don't have to write big, long sentences, and a big, long research project doesn't get pasted in here, because we have to read through all of them. All we're looking for is to see that you are developing the topic along the way, and it can be done with just a brief outline. The time and your reference list, the reference list that we talked about, however many references that you use, we want them to be current, but we know that some topics go so far back, or they're so deep, or they haven't had new research on them, they're going to be older, and we recognize that as well. If this is a doctoral project, because it is your doctoral project, there's a checkbox for you to do that so that we can see that it's a doctoral project. We have a section that's just for doctoral projects, and we will lump them over into that track so that we can keep those all together, because that's important to us as well. The students, we learn so much from the students and their doctoral projects every year, actually, as an organization. Just yours. Still mine. So when you actually click the call for abstract, I'm going to submit, and you log in with your AANA login, this is the screen that opens for you. This is how it looks. Tells you what which one that you're actually submitting the abstract for. It says 2023 Annual Congress. It gives you the dates. It has your name and your profile, any way that you want to submit feedback, and then down at the bottom you see, click here to begin a new abstract.
So this is, once you decide, okay, I'm going to submit something, this is exactly what you will see. Okay. And this is important because we're going to go over screenshot by screenshot of what you're going to see and what you're going to enter in each category. So in here, you'll have to enter your profile, and then you'll actually submit your abstract. You see where it says abstract, you click there, and then you would submit your abstract. In your profile for this example, because I'm going to be speaking and stuff, and she's going to be speaking, neither of us are called Jennifer. For this example, the main speaker's name is Jennifer. Okay, and so we'll show you how that's going to go. So just think, in the main speaker, this is Jennifer. So her profile comes out there. So she's already logged on to the member section. She's already, uploaded like her name, and some of the items will populate. Okay, so.
Yeah. Starting your new abstract, enter your submission title. Title is everything here. So I also review for journal articles that we have. In those journal articles, and the way that we submit for that, big, long, very exact titles, right? And we're going to give some examples of those versus the kind of title that we would like to see here. You're trying to capture interest. You want people to come see your topic. So little catchy type titles are better, and we'll give examples of one versus the other. Which one would you rather see type of title? You only have 150 characters to enter. So we're not looking for the big, long perspective analysis, meta-analysis of the blah, 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 and on and on and on. Yeah. That's not the kind of title we're looking for. So be creative with your title.
And if you think about that, so think about what spurs you to read an article. What really attracts you is the title sometimes, and sometimes a really catchy title. So that's exactly what you're doing here. It's also going to really fill up the room, okay? Because if you have a real catchy title, and we'll show you some examples, I mean, that's the best way. We had one called, remember Mary Jane?
Molly, Molly, Molly.
Yeah. And so you know exactly
Molly,
what those are about,
yeah.
But it was very interesting.
The seats were completely packed. People were along sitting on the floor, compared to something, because he didn't go into the psychoactive drugs of something, and blah, blah, blah. Molly, 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 get your street smart on or something. And we're like, oh yeah, I want to go that one.
So we're reviewing sometimes, 100, 120 abstracts. And when we see Molly, Molly, we're like, oh, this looks great. Like it attracts you, but it's the same thing that it attracts us. It would attract you too. So.
Correct.
Catchy. That's number one. Yeah.
Here it is. Okay, just a few words, not big, long titles. We know the doctoral projects, when you had to submit those as a student, they're big, long titles. You have to be exact of what it is that you're trying to do.
Systematic review, evidence-based, teaching.
So let's look at some of these. These are actual submissions that we've had in the past. No intention of trying to offend anyone. So if this was one of your submissions,
don't be offended.
Don't be offended. Here is Killing Me Softly, Healthcare Providers and Compassion Fatigue. Or a prospective randomized clinical trial of the use of venlafaxine in reducing post-surgical pain and opioid consumption in primary total knee arthroscopy. That's a great title. When I'm looking at a journal article, it tells me exactly how the data was gathered, just in the title, exactly what it's about. But which one do you want to go and listen to as a presentation, not reading as a research article? That's pretty easy to me. Not that there's anything less data-wise in the prospective trial. It's just not the catchy thing that draws in people to come to your presentation. versus the other one. Here's some other examples. Pediatric anesthesia, as easy as the ABCs. Evidence-based strategies for the prevention of spinal anesthesia-induced hypotension in healthy parturients undergoing elective cesarean delivery. We know exactly what that's going to be about, yet they could have
Right.
written it in a much more catchy way.
And what's better is the next one.
Yes.
There you go.
Let's party, old and new psychoactive substances. So this is the kind of thing. And you're scored on the title. So when it says, here's your title, and you have 150 characters, you'll see that we're very transparent in exactly how this is scored. It's also available to you during the submission process. You yourself can remind yourself, if you're not in this presentation, exactly how it's going to be scored, what you're going to be scored on. The title is one of the things that we score it on. So try to make it catchy, okay? This is yours.
Yes. So exactly what you're going to see. So you have to kind of think about your title. But before you even get there, one of the things that you're going to fill out is you're going to fill out what your presenter, conflict of interest, and what your content is going to be. So we're going to go over each one of those sections. So the first thing is obviously, and some of this will auto-populate. So your name is going to auto-populate, right? And so for the example here, if you remember, Jennifer was the person who was submitting this abstract. So her name auto-populates. Why? Because you're already a member. And so a lot of things auto-populate. The only thing that you'll have to maybe fix is where you work, or you know, if you've changed in jobs or anything like that, you'll have to change that, or how you want to be called. Some people don't go by their first name, and so this is a chance for you to fix that. Then they'll ask you if you want to add a presenter. So for example, in this abstract that we're doing here, Jennifer and I are going to work there. So she would add my name as a second presenter. Now this is where sometimes it gets confusing, because then the system will tell you, okay, so the first presenter is Jennifer, right? And so you see all her stuff there, and she completed everything. Some of the things that I'll ask you to complete is obviously you'll fill out, you'll also have to submit a headshot of yourself, okay? So a picture of yourself. And so then it'll ask you the other person's information. Now, the system will send it to that person, so you invite that person to fill out their own things. It will not let you finish the submission process until that second person has uploaded their information. You have the option of uploading some of their stuff too, but they must go in there and upload their stuff. Okay, so this sometimes gets a little confusing, and it was confusing for us as well, because we always test run these things. And year after year, my whole gripe was like, wait a minute, you can't submit until you do this, but it will send them the invite, okay?
You can only have 2 speakers for a presentation as well, no more than 2 speakers. When y'all see the panels up there, that's a different thing. That's different for the conferences that we have, but when you're doing it, just 2.
It gets a little dizzy if you have more than 2 as well, So then you'll have to basically the same thing that we did this morning, and you see that we have no disclosures, we have no financial relationships, and you'll have to put these things in here. And as you're putting these things in here, think that you'll have to have a slide for this as well, okay?
If you do have one,
Yeah.
so let me give an example of presenters that do. So some of the presentations that we have, let's talk about our reversal agents and or our paralytics that are lasting too long. Some of those speakers actually have speaking agreements with one of the nerve stimulators, but they may not be in that capacity when they're actually speaking for us, yet they may disclose, I do speak for Right. I'm not going to say their name. So they would disclose it, but they would also say, I'm not in that capacity as I'm trying to present to you at this particular conference. Does that make sense? So if there is a disclosure because you've ever spoken or you receive funding from one of our reps, a medication, a device, ultrasound, some of those things, there is the disclosure that you have received money from them, but you're not in that capacity for this presentation.
And this is where you would put that. And the other thing is sometimes people speak for pharmaceutical companies as well. And that's not different. For years, we had lots of talks on Sugamidex. And we weren't getting Sugamidex here. It was over across the pond for many years, but we had lots of speakers, and so they had to disclose that as well. Okay. So then you're going to basically attest to that everything that you have filled this far is correct, and you agree with all the, the instructions, and so that's obviously the next part. And here comes the nitty-gritty. So this is exactly what you're going to see, and after this, what we're going to show you is what we see as reviewers and how we grade and the rubric that we use. This is what you would see in entering everything. So you'd enter your title there, just like we said. It needs to be catchy, catchy, catchy. The catchier the title, the more it's going to look, kind of interesting, and the higher that score will be for your rubric as well. Then the topic, and this is very important because if you look on here, what this helps us is distinguish what tracks you're on. So we always have tracks. We have health and wellness tracks. We have practice tracks. And so that will help us distinguish what track it goes. OB, pediatrics, these are all tracks. So these are pulled down menus. Sometimes you'll have more than one track, and that's okay. Pharmacology, anything that you have in there, we'd want you to be in there. And we do have lots and lots of tracks, and we're always adding tracks every year. And sometimes we're trying out different tracks. We tried out the dentistry, dental anesthesia track. Yeah, and so there are different tracks that we try out sometimes. And so, and it really is a reflection of how our committee kind of moves around and, to what the members want, And so then obviously, have you presented this in another meeting? And this is important because if you have, that's great, and you'll disclose where. Now, you don't put, I've talked about this in FANA with Dr. Bender. And some people will put their name on here. So that defeats the purpose because this has to be blinded. If you out yourself, we out your abstract.
Wait, say that one more time because it's important, because this happens every year. So if you put your name or something that alludes to your name, it's going to disqualify all the work that you've done on your abstract, because now we know who you are. And we truly want it to be a blinded process so that there's absolutely no bias and everyone has the same opportunity as everyone else to speak. Because if your name is on there and we recognize George Valdez, oh, he's great, and he's this and that, we may be inclined, you're drawn as a bias, or George Valdez, so don't put your name or someone else's name that you might be associated with. If you spoke at FANA, though, you're going to put FANA, whatever year it was. If someone attended that conference or knows what that presentation is going to be in our committee, we recuse ourselves from grading that so that it's also fair, because we were at that conference and we recognize it.
And that happens a lot. A lot of the folks that we have on the committee are sometimes people that are also serve on state committees doing the exact same function. And so obviously we recuse ourselves from that because it would not be fair. So, one thing that you will have to select here is the time. And we kind of talked about the time that you feel that would be adequate for your abstract. Okay, and so you'd select the time, and sometimes we will kind of request that you reconsider that time and maybe extend it. I think most of the time we ask to extend, not to decrease. The other thing, so here you'll have a couple other things. So how many minutes you'll have of pharmacology. So the reason we asked this is because if you were at the opening ceremonies yesterday, one of the things I said is how many CEUs you will earn and how many of those CEUs are in pharmacology and therapeutics. And this is important because for all state associations and even for the AANA, you need so many credits in pharmacology. And so we have to disclose that. A lot of times people don't appreciate that they are speaking about pharmacology. So if you're talking about addiction, there's no way you can talk about addiction with having some pharmacological, content in there. And so sometimes we catch it. We're really good at catching that, but it does just kind of bring awareness to everyone that most of your topics will be pharmacology. That's what we do for a living. We are pushers, in essence.
And this part doesn't get graded. To be honest, this little section, if you miss this, is not going to get graded. It's just helping us along but we also catch it. We realize this gets missed a lot, and so we catch it ourselves. Okay, they've got these things listed in their content outline, and they are going to say something about Narcan or whatever it is, and we'll put the appropriate pharmacological hours in so that we make sure we get our pharm hours, because we know we need it so our DEA gets taken care of.
So this is where you would disclose if it's a doctoral project or not. And that's important because, like Dee said, we basically lump a lot of the doctoral projects together and we put them in the same category. Now, identify the gaps. Now, you'll see that there's a little asterisk there. So there is a resource page. There's a resource link on top of this page. So this is obviously, you open this and it's a long page. On top of that page, there's a little resource center. It's about 7 pages long. And it will tell you what each section kind of means and examples of each section. So identify the gaps. Let's say that, I think the easiest thing that we can talk about, maybe Sugamadex, right? So if you identify the gaps, say that it was when Sugamadex had not really been out in the United States yet. Well, some of the gaps were, not as many studies in the United States, not used in the United States, and that's it. You don't have to go into great detail here. It's just a little blurb of what you feel the gap is and why you think that this is going to be important to us, right? And you do start getting graded for this, and we'll show you that in just a second. Describe the current state. So in the sense of Sugamadex, that would be the same thing. Sugamadex is not widely used, obviously now it is, but, so you would say Sugamadex is not widely used, and so it's not used in the United States, and we want to educate our members as to this. The description of what the desired state is, well, the desired state would be to educate our members, right? And so they do seem a little redundant, but it all has a purpose because it all builds a model for us to look at, okay? And now we'll get into the bigger items of what really kind of is the most points that will be for you. You see, this describing the state and your current state, this is not the big ticket items. The big ticket items are going to be your learner outcomes and your description, okay? Those are big ticket items. So with your learner outcomes, you'll have to do, depending on how long you're envisioning you speaking for. So if it's for 30 minutes, you'll have 1 learner outcome. If it's 60 minutes, you'll have 2 learner outcomes, and so on. And it doesn't mean you can't have more learner outcomes. You can, but you're not required to do that, okay? So, but the important part of your learner outcomes is that they must be measurable. And what do I mean by measurable? So let's skip ahead a little bit. Measurable means that they should use Bloom's taxonomy. Bloom's taxonomy is, you may have heard it when you were going through school. If you're an educator, obviously you're really well apt with Bloom's taxonomy, but they used to use measurable action verbs. And so for most of the presentations, we use 1, 2, and 3 level of Bloom's taxonomy. So the first 3 levels, which would be knowledge, understanding, and applying. And you could use any one of those action verbs. Now, as educators, as you go through your program and you get into higher classes, that's when those other Bloom's taxonomies comes in, where you analyze, where you evaluate, and where you create. And these are all action verbs. And so if you remember our 2 objectives, one was to identify and the other one was to describe, right there on Bloom's taxonomy. Identify and describe. And a lot of people don't use these, and this will knock you down in points. The other thing that will knock you down in points is if you're going to speak for, 60 minutes and you have 1. We put that in the instructions, you must have 2, and so that'll knock you out in points. And I find that those are things that common pitfalls, I guess, if you may.
And it doesn't have to be a long learner outcome. The space is in there, but it's not. Identify the use of Sugamadex for reversal.
Yeah.
It just is. It's just using the correct term. It'll get corrected if it's not. But what it is that you're trying to do, what it is you're trying to do, but we want you to try to use that. Brett, we look at it, but it doesn't have to be a big, long thing, because sometimes they're very long and then never accurately describe what it is you're doing, and we can't tell what the intention of your presentation is for.
The shorter, the better. If you can communicate what you intend to say in just a few words, that's much more powerful than some really long sentence. Those were words by Ernest Hemingway. So, your learner outcomes. Your learner outcomes, obviously, 1 per every 30 minutes, okay? And that is obviously a requirement that we have, and so that's one of the pitfalls that we see often. You want to state what the purpose is, like the statement of knowledge, skills, learning skills, describe, understand. Those are the 2 easy ones. Identify. I would just stick to something very simple like that, okay? And that obviously has to do, it relates back to your topic as well, what your title would be. And definitely, please use Bloom's taxonomy. I couldn't stress that enough. Why? Because not using Bloom's taxonomy, a lot of times it doesn't look as a professional submission. And I kind of trying to not say abstract because I want people to kind of think this is just a presentation. Don't be intimidated by the abstract. We want more people to kind of put in there for abstracts. And, even students, you won't be students forever. And you did some really cool doctoral projects. And some of those really cool doctoral projects, you can kind of talk about that. You're the subject matter expert now. Okay. So this is exactly what it looks like. And so your teaching methods is the next box that you will fill out. That's a really easy one. PowerPoint presentation, an interactive talk, PowerPoint and videos. If you're planning on doing something else, then you kind of talk about that. But for the most part, it's going to kind of be limited to those 2. And that's okay. So you don't need to write something really long here. That's just it. And now here's the big kind of what you really got to focus on and what you got to be worried about. So what the description is, that short description, okay?
250 words or less.
Exactly. Some people give us the entire dissertation or their entire capstone project. Yep. That's not what we want here. Short, okay? Just a nice short description of what you want to accomplish, okay? Be very specific. You can tease this out of, a project that you did, if it was a capstone project or a dissertation or, anything that you did that is amazing. You can tease this out of that, but keep it short and concise. Okay? You don't have to say here, don't repeat what you've already said. Don't repeat the current state. Don't repeat what you plan to do. Don't repeat that you're going to do it through PowerPoint. No, just describe exactly what you're going to talk about. So you talk with the Sugamidex, here I would say Sugamidex has been a drug that has been used in Europe for over whatever years. It is wonderful for reversal. It avoids all the common pitfalls of neostigmine and glycopyrrolate. You talk about things like that. Get us excited of why this is a good presentation.
This is what you see in your mobile app.
Mm-hmm.
This is what is on the website. This is what your potential people that are coming to see your presentation will see and why they're going to choose to come to that presentation. What you put here, your title, and this is what they see. What you're looking at in the app is the description that they gave us.
Title, the short description, and your learner outcomes. That's exactly what comes out in the app. If any of you pull up the app, that's exactly what you'll see for this section. And that's important because you want to make sure that you are describing exactly what you're going to say and how you want people to look at you. Your face, your mugshot will be penciled in there with the short description and the learner outcomes. So obviously, you bring your best face forward, right? And then obviously one of the other common pitfalls that we kind of talked about was the evidence. And so this is something that this can't be, I'm just going to talk about this because I'm knowledgeable about this. We've moved away from that. We are now into a world of evidence-based practice. And as evidence-based practice, you must have references. You must have references for things. Even topics on historical things, like if you're giving me a historical perspective of CRNA practice, there are articles, there are books that you can reference. In that example, that's where we say we understand that it may not be within 5 years. Okay? But you want to try to keep to that, because most of the topics that we talk about are going to be current. There are going to be evidence-based. And so there'll be research journals, and there'll be all kinds of topics that you can kind of include there. But your references are very, very big. And we do want, at least within 5 years, how many references? I would tell you, we kind of look at it and we kind of think, well, you kind of have to have at least 3 references is what you should have, right? Most people have much more than 3 references as well. Okay.
One reference, though, just one study that you not so good.
No, that'll bring your score down. So you want to be successful in this endeavor of the bragging rights of speaking at the AANA Annual Congress. That's so exciting, right? And so how do you get that? More references, catchy title, references, catchy title, to the point, short description, very important with a short description. Okay. And so the last thing would be the DMP project sponsor. And the reason we want to know that is because obviously if you're working with a DMP, if it's a DMT capstone or project or whatever your college or school calls it, we want to know who that sponsor was and who the person that wrote this with you was. Okay. So this is the actual scoring rubric that we use. This is full transparency. So as we are scoring this online, this is the actual rubric that we are filling out, okay? And so it ranges from 1 acceptable to 7 excellent. And you look at this abstract title. We talked about that. So you have this really catchy, great title. It's like, wow. And it relates to what you're talking about, right? Relates to what your topic is about. That's pretty important, okay? Because if your title is so cool, but it has nothing to do with what you're going to talk about, you're going to get less points here, okay? And we've seen that too. Then obviously learning outcomes, and we talked about that. We want to use Bloom's taxonomy. If you're doing a 60-minute talk, you want to have at least 2 learner outcomes. If you're doing 30 minutes, have 1. And it's a good learner outcome, and it's using Bloom's taxonomy, and so we'll give you the points.
Probably where this one gets scored down is the learner outcome actually doesn't relate back to what it is that you're talking about. So when you're writing your learner outcomes, make sure that they actually go to the topic and what it is that you're trying to get across. I mean, as educators, you actually you kind of do it backwards. You start with your outcomes and you build your content around the outcomes. That's how you do it. What is it that you want to accomplish? I want them to know how to use Gammadex safely, the indications, the contraindications, the side effects, the things like that. So that's where you start, make your learner outcomes, and then build your brief outline around the learner outcomes. So you're thinking, what am I trying to get across to them? That's your learner outcome. Make sure that it goes to the content and the outline that you've presented for us to look at.
And a lot of times the first learner outcome can just be identify certain points of your lecture. And the second one would be describe how you can use this successfully or safely in your practice. Those are 2 really easy learner outcomes to write. So, and it's true, we do begin as educators, we begin with the learner outcomes and then go. As someone who's not used to doing that, it may be easier for you to do it the other way, but always you have to think about what the purpose of you coming and presenting something is. And I think that would be the way to go too. So the clarity of the abstract, and we kind of talked about that, make sure that it is short and concise. We cannot stress that enough. Sometimes we get really, really long abstracts, and that's a problem because we can't really put them in the app either. And we'll have them in the app, but it's really long, and so you want to make it something catchy. What your point is, what your gist is, and it's going to help us look at it, and it's going to score you higher. If it's over, we don't sit there and kind of look, okay, over 250 and stuff like that. But if it's really long, we may actually say, no, we need to score this a little bit lower. We really want something short and concise and to the point.
Not to put your entire doctoral project in there. And literally, sometimes it has been almost the entire doctoral projects in there. So now we're reading your entire paper. It populates into there. I don't know. I don't know what they're really talking about. They're giving me research, but I don't really know what they're talking about. So look, you got scored down because if you look at our rubric, does the abstract provide information to what they will be covering? No, because are they covering the methods of how they did the research? Are they covering, because your entire project
Everything
is in there,
yeah.
right?
Yeah.
So if you have, and we love to have the student doctoral projects, because your projects are most current evidence, you actually bring a lot of new practice to CRNAs that have been out for a while and haven't been reading their journal articles as they should because they've been working 24-hour shifts and they're exhausted. So y'all have a lot of the current evidence. It's able to condense that information and put it into a small outline, what it is that you're going to teach us about, because we learn that way.
Let me see if it's a creative or original, and that's always very nice too. And sometimes we get very, very creative and original abstracts or titles. One of the most original titles we had recently and talks, and I mean, that scored really high because it was something that we don't really see very much, was mass shooting in the OR and how to deal with that. That was really, really interesting and innovative. That's kind of what this is. Is it an original and creative idea? If you're going to talk about the use of Zofran of post-op nausea and vomiting, I hate to tell you, it's not very creative or original. It's kind of already been done, right? And so obviously that's something that's going to be scored less. What's the quality and scientific validity? And that's something that we're looking at, obviously, within your abstract. So we're reading about this, and we're seeing, okay, so are they basically kind of relating it back to the evidence, okay? And a lot of times within your abstract, that's where you're going to reference your references. And so is this evidence-based, or is this just, I'm just knowledgeable about this? I've lived through this experience. Well, that's not going to give us scientific validity, okay? Is it an organized thought process? And I think that everybody kind of, as CRNAs and sRNAs as well, we are really good at organization. And for the most part, we don't have random thoughts in an abstract. Sometimes we do. There are some type B people, yeah. But for the most part, everybody presents things in a very organized fashion. But these are all the things that we're grading. So there's multiple ways of grading that short description, okay? And so that's really where people can lose a lot of points as well. Mm-hmm. So, I think this is your part. Yeah. It doesn't matter.
So these are just the questions that we also look at. You saw the rubric. You see how it's graded. Did they do it? I agree. I don't agree. They're, it's pretty generalized. Was the approximate presentation time requested by the presenter adequate? These are open fields that we as graders put in there.
And
so
we'll show you that in a
if
second.
we find they only asked for 15 minutes and this topic is really interesting, like we spoke about earlier, we're going to comment right there. No, this topic is important and we want to hear more about it. And at the end of all the grading, when Jennifer populates all of the scores, she also populates all the comments that every reviewer has written. And we review all of the comments and then we talk about it. When you were reviewing that abstract, did you find that to be true as well? Yes, we think that needs more time on it because that's a good topic. So she will contact the person that submitted back to ask them, can you increase that? And they also want you to perhaps add a little bit of something about this, because we talk about that. Still blinded, but she's going to contact the person that submitted it and ask them if they would be willing to go longer or add an additional thing that we think would be important to that topic. So that's what these open responses are. This is still our grading. We just want you to see transparently what we're grading on, and this is how we communicate. Right. And when we come together as committee, then after everything has been graded, we review all of our comments together as well.
And we are all assigned so in the committee, say that there's 7 people in the committee. Those 7 people are assigned about 100 abstracts. And it's not only our committee, maybe it's our committee and say that the topic is on wellness, well then the wellness committee is also assigned those abstracts. So when we come together, one abstract may have been reviewed by 8 or 9 people, you see. And now all the abstracts are then pulled together, and as they're pulled together, it populates the magical number, right? And as it populates this magical number, we look at that and we basically, it's easy math. There's a rubric, we take who the highest people are, and those that are at the highest, those are the ones that are presenting. And we pick those with the highest grading points, boom, 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 okay? So we also do not know who any of these people are. So this is all blinded. And we do that for a reason, because we want to give everyone a chance to present, and we want more and more people to present, okay? So these are some of the gradings that you would get that kind of populates as to the end number. And so if you're between 34 and 42, that's highly likely that you will be speaking and that your abstract will be chosen for the next Congress. These are some of the committees that obviously review along with us: the Professional Development Committee, the Practice Committees review, the Wellness Committee, the DEI Committee as well, and those are for various topics. Now, this happens for every single one of our meetings. So very similar to this is for the leadership conference, and I know the educational committee who's in charge of the ADCE, did I say that? ADCE, yeah. ADCE lectures and meetings, they do the same thing, and so they have a rubric of their own as well, okay? So it could help you for all these things, for any lecture, any place that you want to speak at. So this is exactly what we see now. So everything that you guys populated on our end, and we use a special program, and that special program basically gives us this. And so we just go down and we grade everyone's abstract. And these are pulled down, I can't, the little pointer here. Right here. So these are little pull down menus, and those pull down menus will score everything from 1 through 7.
You see that those are the same topics that were on the slide that was the blue slide that said 0, 1, 2, 3, 4, 5, 6, 7. That's exactly what we're looking at, and that's how we're scoring it. It's just we're putting our number there. On the left-hand side, there's your title. Here is the proposed track that you put it for pediatrics on this particular one. See the first choice, the second choice. Has it been presented? So how you answered those questions, we get to see that, and it goes on down. We look at your learning outcome, then we're able to see your short description, and then we see the content, and then the very last thing is your references. So as it goes down. And those are the questions that we just talked about. This is where we put our score, all blinded. It all populates to a sheet that scores and gives the overall score based on what it is here.
And if this is, and as you can see, and I want to point this out, and this is important because we really want to stress how this is a blinded process. If we recognize the topic, or we went to that specific conference, we will abstain from the review, okay? Again, blinded. We want to give everyone a fair chance, and we want to stress that to everyone. And so,
remember this rubric, when you get ready to do your submission, the rubric is available to you there, as well as the resources that help you write the learning outcome, write the identified gap. There is a resource in there that gives you examples of others or ways to write it so that it helps you to be able to do those things that you're not used to doing.
So these are the same thing, the same questions that we went over, that we are grading everyone: the clarity, the quality, creativeness, was the abstract organized. So this is all basically on your short description as well. And that's where we get the bulk of the information. That's where we kind of get it. We know everybody's going to present via PowerPoint or, a lecture series. We got that part. That's the easy part. But, this is really where we give the most points, is that short abstract submission, okay? And these are just different things, and we kind of suggested, we review it, and it gives you a number. and then all the numbers are tabulated for us. Okay. Now, within this lecture, we've also put in and embedded a video into the PowerPoint, and this video will go step by step on how to submit this. This video will also be available, and this is why we're taping it, will be available for you to review when you're submitting that abstract. Our hope is to get more people involved in the abstract submission process. We get lots of abstracts every year, but we want more. You know, it'd be nice to get over 500 abstracts a year for annual Congress. Why not? We have some incredible minds out there. And let's face it, you know, the road to become a CRNA, you gotta be pretty intelligent, you know? I mean, I'm glad I did it when I did it, because I'm not sure I could do it now, you know? So, and these are our references. As you can see, we have 2 references. We spoke for 60 minutes, and these are 2 references, okay? And we